For the past month, Arizona's family has reported on almost every angle of the state's opioid crisis.
Tonight, Chief Investigative Reporter Morgan Loew shows us how drug abuse is devastating one of Arizona's rural counties.
A place where prescription pills outnumber people, and police are now doubling as paramedics.
Historic Route 66 runs right through Kingman, Arizona. And while tourists and history buffs might see examples of Americana lining the streets, police officers like Sean Wyma have been seeing something else.
We noticed that there's a lot of thefts, property crimes.
The telltale signs of a drug epidemic.
They need to support themselves or support a habit.
We spent 2 hours driving around Kingman with Officer Wyma.
We've been staying clean.
I have.
I know last time I talked to you, you had a little bit of issues with drugs.
Yep, nope, I'm clean.
And every encounter we had was drug related.
He's got a couple cell phones, a bag of guns.
The hotel here called the police department because one of the guests was acting, I guess, kind of crazy under the influence of either heroin or meth.
He was almost in a catatonic state where he was incoherent but awake.
How does this epidemic affect Kingman Police Department?
Significantly.
Police Chief Robert DeVries says it has forced the department to change the way it looks at drugs, embracing the idea of needle exchange programs and offering first aid to drug addicts.
How do you sell that idea to residents who may think law and order doesn't mean that?
They had to sell it to me because I was of some of the mindset too is why would we want to provide them a tool to further their addiction?
Ultimately, DeVries views this as a public health crisis, and Kingman PD has led the way, becoming the first department in Arizona to equip its officers with Narcan, an antidote for opioid overdoses.
Let the medicine work.
Since then, officers have used Narcan to save the lives of 5 people, including this man.
There we go. Let the medicine work.
I was one of the first officers on scene there.
That was a different kind of call to duty for you.
A little bit.
The opioid epidemic is not isolated to Kingman. It is rampant throughout this county. In Mohave County in 2016, doctors wrote more prescriptions for opioids than there are people living in the county. Some high-profile stings have reduced the number of pill mills operating here, but walk through any empty lot in Bullhead City.
Here we go. Yeah. Yuck.
And you'll see what addicts turn to when they can't get pills anymore.
And I've got to watch my step around here.
Needles discarded on the ground, used for heroin.
I do think this county has unique challenges.
Jasmine Myers is a program coordinator for Southwest Behavioral Health in Bullhead City. She sees the effects opioids have had on the community and how state funding limits the amount of services that are available.
Some people need acute placement, some people need more outpatient-based services, so the more funding in those areas, the better we can combat the challenge.
Health and law enforcement officials agree a change is needed. Funding, education, and new ways of looking at the opioid crisis.
If we continue to just do what we're doing, we're going to have over 1,000 deaths in 2019 just from heroin. That's not counting what we may experience from a rise in the hepatitis and HIV rates. We have to shift gears. We have to make a change.
And in January, state lawmakers passed a package of laws that should help people in places like Mohave County. The laws are designed to make it tougher for pill mills to operate and provides an additional $10 million for people who can't afford drug treatment. But that's nowhere near what is needed to fix problems in counties like Mohave, much less the rest of the state. Chris?
Morgan Loew. Morgan, thank you. Now, to watch more of Morgan's investigations, head to azfamily.com or download the AZ Family mobile app.